We're seeing more variant strains popping up in Connecticut, which are more contagious than the original COVID strain. So where do we stand today, and how are scientists keeping track of them? I got some answers from a Yale medicine physician and researcher at the Yale School of Medicine.
The CDC identifies 3 so-called variants of interest. They're watching the UK, South African, and Brazilian strains.
Certain variants may have more relevance to public health because either they're more infectious or potentially, more harmful or more deadly.
Dr. F. Perry Wilson is a researcher at the Yale School of Medicine. He says the UK variant is dominant in the U.S. right now and 50% more transmissible than the original coronavirus. Data on whether you'll get very sick is currently mixed. Dr. Wilson says the vaccine works quite well at preventing disease from that variant. On the South African strain, slightly less.
It's not the slam dunk efficacy that we saw with the native coronavirus and the UK variant. So it's definitely something we want to watch.
He says the new New York variant has one of the same mutations as the South African version, which the vaccine is not as effective against.
Will it have the same effect on the vaccine? But that is something we're all concerned about.
And he says that New York variant is here in Connecticut.
Yale researchers are doing their own sequencing and have found a smattering, less than a handful of cases across Connecticut of that New York variant.
He says mostly in Fairfield County. And Dr. Wilson reminds people that vaccines that target variants will need trials and FDA approval.
Moderna is already testing an updated vaccine that they anticipate will have more efficacy against these variant strains.
All right, let's get some more answers to your questions. Dr. Abrantes, this one is for you. I wish you would inform us about what to do and where to go if we are among those who might have an anaphylactic respiratory reaction. I'm worried that no one at a random Walgreens will have the skills to intubate, but I can't get any information about where to go or how to get an appointment at a place that can accommodate this possibility. Great question.
Yes, great question, especially as people fear about that. So first and foremost, it's an extremely rare possibility that folks will have anaphylaxis to the vaccine, and nothing beyond what we've seen with other types of vaccines as well. That being said, if someone carries an EpiPen already, that's something that they should carry with them if they are going to get the vaccine. But all facilities, even pharmacies included, really should be equipped to be able to deal with anaphylaxis if it does occur. And if you aren't at a hospital, obviously they would help with dealing with the anaphylaxis, calling an ambulance, and then getting you the care that you need.
Okay. We got several questions about homebound population in Connecticut. Dr. Gifford, if you can weigh in on this one for us. Russell in Middlebury asks, with the approval of the single-shot J&J vaccine and its low-temperature storage requirement, will the homebound be able to receive their vaccinations at home? What do you think?
Yeah, so we've already begun, as have many of our vaccinating partners, to vaccinate individuals who have trouble getting out of the house and getting to medical appointments. There are all kinds of strategies that our local health departments are using to identify and then bring vaccine to individuals who are homebound. Obviously, visiting nurse agencies are doing that. The J&J vaccine, undoubtedly, because it's got simpler storage and handling requirements, will be helpful there. But we had started already with our homebound programs even before the J&J product came on the market.
All right, now we have an interesting one for Dr. Giuttani about how long the vaccines will be effective for. I have a son and daughter that teach in 2 different Connecticut counties. They were both told they will get the vaccine in March, but is it only good for 3 months? Is there something new or just rumor?
So we are still looking at how long vaccines will be effective for, but I do anticipate that it's going to be longer than that. For a lot of the studies that have been done, they are still following patients that were enrolled in these trials to look at their immunity and potentially if they get COVID-19 over the duration of several months. So I think there'll be more information to come, but I do anticipate that immunity is going to last for longer than that period of time.
All right, thanks, Dr. Giuttani. So what do we need to do once we've had the vaccine? We'll talk to the doctors about that.
That's on the way. Also, we're going to ask our panel their final thoughts about these vaccines in just a moment.
Hi, everyone. I'm Laura Hutchinson. Coming up tomorrow in Good Morning Connecticut, teachers across the state rolling up their sleeves to get their COVID vaccine. A closer look at how districts are doing. Plus, middle school students in New Haven return for in-person learning. A look at the back-to-school plan. How are we looking, Gil?
Well, after a good day today, it looks like temps may chill a little bit for tomorrow, and then a freezer Friday. We'll have your full forecast.
At least it'll be Friday. Hope to see you tomorrow before Good Morning America.
Don't miss New England Patio and Hearth's preseason sale going on now. Transform your outdoor living space and create the home of your dreams with tremendous savings on all inventory.
There's a style to living at New England Patio and Hearth.
Area Cooperative Educational Services, ACES, is dedicated to enhancing and transforming lives through education, innovation, and leadership by offering a broad array of services for students, parents, and school districts that include autism programs, behavior services, professional development, international, school security, and much more. ACES, serving the needs of the educational community for over 50 years. To learn more about our services, visit aces.org.
Welcome to Kitchen Cabinet Outlet, the kitchen and bath supermarket. Our showroom is 9,000 square feet. Free estimates and free design help with our 3D mapping technology. Vanities starting at just $1.99. Open 5 days a week in Southington and Waterbury.
Brought to you by Kitchen Cabinet Outlet, the kitchen and bath supermarket.
With more people getting these shots now, it's important to point out what you need to do after you get vaccinated. You should still wear a mask, stay 6 feet apart, and avoid crowds. Dr. Jutani, is that just for the 2 weeks after you get that last dose and then you're all set, or do you still have to wear a mask after that?
For now, while we still have a lot of virus circulating and while we're trying to figure out what it means if you can transmit virus even if you've been vaccinated, we do need to continue to mask and distance, even if you've received both of your shots of vaccine. I know this is disappointing to many people. We all want to get back to some normalcy in life. But until we really know that if you've been exposed to somebody who's had COVID-19 and you get it either with mild symptoms or asymptomatically, whether you can transmit it to somebody else, we really need to continue these public health measures. So we need people to hold on for a little bit longer, work with the team to keep up these public health measures so that we can get those answers. And hopefully with time, those will be able to relax as well.
Yeah, Dr. Abrantes, I'll ask you the same kind of thing. There are some tiny bits of early data on here that look promising. The question is, can you transmit COVID after you're vaccinated fully? We hope not, but we don't know. That's right?
Right. So the main concern was about asymptomatic transmission, especially in folks who are fully vaccinated, even more so for people that are around them that are unvaccinated. Now, with a lot of vaccines, it's usually decreases transmission. But again, like Dr. Jutani mentioned, until we really have that concrete data, and we are starting to get real world data from other countries who've done a lot of mass vaccination as well. And while that's reassuring, I will continue to wear my mask, especially until we have more data, but even more so because there's so many people that are still waiting for their vaccine. And for me, this is the ultimate sign of respect to make sure that we pull out of this together.
All right, now we have a question from Valerie about what happens next.
Hi, I'm Valerie from Guilford, and my question is, it's been over a year since my husband and I have been able to visit our grandchildren and family up in Massachusetts. We've both received our first dose of the Moderna vaccine, and we will be completing our second dose, and wondering how far beyond the 2-week safety period is it okay to visit and possibly stay overnight visiting the family?
A lot of people wondering. Keith Grant, what do you think about that?
I'm with Dr. Abrantes, and it's a very difficult message at this point in time. But we're still waiting on a number of studies that are ongoing. I'll tell you the preliminary data looks good. But even with the data released, what we do know is what we've implemented and what we've been practicing throughout the state of Connecticut and throughout many areas in the country has so far been effective to getting us to a very good point. In regards so I would say in regard to visiting, I would say try to limit that as much as possible. And if you do have to visit, implement and maintain those practices that have gotten you to this point. So proper hand hygiene, ensuring you're wearing a well-fitted mask, and maintaining physical distancing.
All right, Keith, thank you. We're all hoping for good data on all of this. All right, listen, we want to give each of you a chance to share final thoughts about this vaccine. Please keep it to about 30 seconds. We're almost out of time here. Let's start with you, Dr. Gifford. Why do you want Connecticut to be vaccinated?
You know, it's been a great week this week. We have 3 highly effective vaccines. We've administered almost 1 million doses here in Connecticut to people. And this is our path to getting past this pandemic. So I know many of you are anxious, and more vaccines are on the way. And if you are eligible, this is our path back to normalcy. So go ahead and sign up and get your vaccine.
All right, thank you. Dr. Abrantes?
So we all want this pandemic to end, that's for sure. Continued infections is not the answer, and really we do have to vaccinate our way out of this. We have 3, like Dr. Gifford had mentioned, highly efficacious vaccines, so whichever one is available to you, when it is your turn, I would encourage everyone to roll up their sleeve, get the vaccine, because really without doing this as a state, as a country, as a world, we really won't be able to get out of this. And for that, just for everybody to stay safe and to continue masking until we really have more of that data.
All right, Dr. Everett.
Each of us has to make the right choice for ourselves, our families, and our community. Included in that right choice is the vaccine. Making sure we have the right information to make the right decision when it's available is my focus, and I think that's why we need to think about this as a collective on how we make the right choice to make sure that we are healthy, happy, and safe for ourselves, our families, and our communities.
All right, thank you. Dr. Giuttani.
Vaccines are really a scientific feat that we've been able to accomplish in 1 year from when we first saw this virus infiltrate the human population. And it is our way out, as Dr. Gifford said, to getting back to normalcy in life. Getting vaccinated protects yourself, your loved ones, your family, your community. And it is a patriotic thing to do, I really feel, to be able to help our country get back on its feet, because when our health is back, our economy will be back, and our lives will be back with that.
Very true. Tight on time. Archbishop Bailey.
Yes, I believe that it is most important for us to get vaccinated so that we can get back to a normal existence. I would pray that my colleagues will encourage their people to do likewise. We have a vested interest. The scripture says, forsake not the assembling of yourselves together, as is the manner of some, even more as you see the day approaching. So we love this contact because we are spiritual beings housed in a body. But at the same time, we realize that our spirits working together brings about a more powerful force and entity. And
all right, looks like we're tight on time there. Keith Grant, final thoughts?
Yeah, absolutely. So, some quick data. So, Connecticut made a quick decision in ensuring that our nursing home population got vaccinated really quickly as soon as we had the opportunity, and our healthcare providers, high risk group, high mortality group, or nursing home population in some areas had mortality rate upward of 40%. That's decreased exponentially. So exposures in the healthcare settings have decreased, and clusters have decreased. So areas where vaccinations have been done a lot, we're seeing significantly better numbers. So we believe it's working, it's effective, it's safe, and when the time comes, get educated and get vaccinated.
Dr. Salazar, 15 seconds.
Yeah, thanks. I just want to tell everyone that we're doing a much better job now. The vaccines are safe, will prevent death. Please go ahead and get vaccinated. There is light at the end of the tunnel. Don't lose your sense of optimism and positivism. We will get there. Hang in there. We'll be okay.
All right, we want to thank our panel and our guests tonight for joining us. Thank you. A
lot of great information. All of this up at WTNH.com and the News 8 app. Our next newscast starts in 3 minutes on WCTX. I'll be back here with Ann Nyberg tonight at 11. We'll see you then. Thanks for watching.